Hi everyone, thanks for joining. We'll start now. My name's Syra, I'm one of the managers here at First Care Practice, and today we're running a webinar on hypertension. This is following on from some feedback we received from all our patients on online webinars that we were running. So we'll start off today with hypertension. We've got Rowena, our physician associate, and if you have any questions, please feel free to use the chat button along the bottom, and we'll try our best to answer. Also, if we do have any technical issues, please bear with us. So without further ado, I'll introduce you to Rowena.
Thanks, Sarah. Hi, everyone. My name is Rowena, a physician associate at First Care Practice, HIOS. Thanks so much for joining our webinar today, where I'll be talking about high blood pressure or hypertension, which is the medical term. So hypertension is such a common health condition which needs to be well controlled. I hope this webinar will be able to inform you about understanding your blood pressure better and how you can improve it. So before we go ahead, let's do a poll. So on your screen now, you should be able to see a question. So, is your blood pressure controlled? You can either answer yes, no, or don't know. Please answer. We'll give that a few seconds. Good. So give it a few seconds. 3, 2, 1. Okay. So I've got 50% yes and 50% says don't know. Okay, so that's interesting. And hopefully this webinar will be able to, so for those patients who said don't know, hopefully we'll be able to figure out why. And yeah, let's go on. So, Sarah, let's start the presentation. So, what is blood pressure, or what is high blood pressure? So, high blood pressure is the pressure of your blood traveling around your body through your blood vessels. So on your left, you can see a blood vessel or your artery, and it's nice and open. Blood can move freely and nicely. And then on your right-hand side is a blood vessel. And as you can see, there's fatty material around the blood vessel. And so it's narrowing the blood vessel, and the blood flow is more restricted than normal. So blood pressure, sometimes it can be known as the silent killer. A lot of people are probably walking around not knowing that they have high blood pressure because it doesn't show any sort of signs or symptoms. But other people do say that they know that their blood pressure is high because sometimes they can feel dizzy, they can have headaches, they can also have blurred vision. But the only true way of finding out if your blood pressure is high is to have your blood pressure checked. So why is it important for your blood pressure to be well controlled? It's because poor blood pressure control can cause heart attacks, strokes, heart problems, can even cause damage to your kidneys. Okay, so what is the normal blood pressure? So everyone usually says your blood pressure needs to be 120 over 80. What's the top number? What's the bottom number? So the top number is the pressure of your blood when your heart contracts or beats. And the bottom number is the pressure of your blood when your heart is relaxing, so in between beats. So yes, ideally blood pressure should be 120 over 80. However, people with other health conditions such as diabetes, heart conditions, or kidney conditions, ideally your blood pressure should be under 140 over 90. This is still acceptable. So moving on to risk factors. So having increased alcohol intake, being a smoker, being overweight or obese, or having a lot of salt in your diet can increase your chance of having high blood pressure. There are things that we can't change. So for example, the older you are, your likelihood of having high blood pressure is increased. And also, if you have other health conditions such as diabetes, your chance of having high blood pressure is also increased. So how can we improve our blood pressure? Next slide, please, Sarah. So how can we improve our blood pressure? So obviously, making sure that if we do smoke, we have to try and cut down and eventually stop smoking, definitely. If you lack a lot of physical activity in your everyday routine, it's good to increase your physical activity. So it's not necessarily about joining the gym, just kind of doing jogging, walking, getting your heart racing, definitely getting your 5 a day, so increasing your fruit and vegetable intake, reducing your alcohol intake, and your salt intake. Compliance with medication is really, really important. So if you do take medications for high blood pressure or any other health conditions, please take your medication as advised. If you don't take your medication for high blood pressure, that means that your blood pressure will be high and your chances of having things like a heart attack or stroke are increased. And of course, making sure that you monitor your blood pressure regularly, or making sure that you attend for your blood pressure checks regularly. Any questions? Please feel free to type in your questions at the bottom and we can pick those up.
I have someone with a question. Let's have a look. So I've got Maria. Maria, you feel free to talk and answer the question. I'll just unmute you.
Does anger has any effect on blood pressure?
So that's a really good question, Maria. Thank you. So anger can cause you to become stressed. And I believe studies have shown that increased stress can increase your blood pressure. So I guess it's always good to try and make sure that you deal with your anger issues and remain calm as much as possible.
Thank you, Rowena. I've got another question. Will I get a headache if my blood pressure is high?
Okay, good question. Some people do say that they get symptoms such as a headache. Some people don't have any symptoms at all when you have high blood pressure. So it doesn't necessarily mean to say that if you do have high blood pressure that you will get a headache, definitely.
Thank you, Rowena. Can't see any more questions, so we'll end here. Just before we end, if I can ask everyone to just complete the last poll, just to provide some feedback on how you found this webinar. Should be coming up on your screens now. All right, so thank you everyone for joining, and we'll be having many more webinars soon. Take care, bye.